Good evening. Thank you, Representative Hayden and members of the committee for allowing me to share this wonderful evening with you guys here. It's an introduction. My name is Bassam Hadi. I'm a board-certified neurosurgeon. I practice in St. Louis. I am Department Chair of Surgery for Mercy Clinic South and also Medical Director of Spine and Pain for Mercy East. I am testifying in support of HB 329. I have had the unique opportunity to work with a solo CRNA practice in rural Missouri, as well as with CRNAs and anesthesiologists in St. Louis. At both locations that I've worked at, the CRNA care was excellent. I honestly saw no difference in the care between the anesthesia provided by my solo CRNAs in the rural Missouri and the CRNA physician collaboration team that we have in St. Louis. At both locations, my patients received excellent care. I was impressed with the quality of care done in rural Missouri. We were able to do quite a few surgeries. The bill intended before you will not remove the physician involvement, will not change the relationship between the CRNAs, at least the surgeons. I think we're all here for the patient's best interest, and they've done a very good job. As a surgeon, I would prefer not to be liable and in charge of something that I am not an expert or trained in, although I would be happy to collaborate and work with them toward improving the patient care. With that, I'd be happy to answer any questions from anybody.
Questions? Representative Keithley?
Thank you. To inquire?
Yes, go ahead.
I'd like to not be liable for a lot of things in my business too, but so a question I have is, I'm in your role as a neurosurgeon, how many of your patients are you meeting with pre-op, build up to surgery, how far in advance?
Well, I mean, obviously, with every patient, I'll see them preoperatively, both in my office. I'll see them the day of surgery. I'll see them postoperatively, and we'll follow up with them in the clinic afterwards.
And how much involvement do they have in a pre-op with the CRNA or the anesthesiologist, whoever's providing that, in the build-up to that?
You might want to ask them about that. They have their own specific areas that they ask about questions. I do my area based on what I check for my neurosurgery surgery that I'm going to proceed with. Mm-hmm. So I don't want to answer something that I'm not an expert in, so I would defer to them to answer what questions they do and what they do preoperatively.
And then in terms of choosing a CRNA team or staff person, who's making that decision ultimately?
So I had influence if I would, had preferences on somebody that I worked with, whether personality issues or just people that, you liked more, like you would any other field. But I did not make those choices. They were assigned to me by the staff, whoever's running the board, or the anesthesiologist group had some sort of process for putting people in my room.
Okay. Thank you.
Representative Fogel?
Just a few quick questions. When you put a patient under, I don't have the right terminology. When a CRNA puts a patient under, are there things that regulatory guidelines on how close you have to stay in proximity to that patient as a surgeon? Like, is there anything that says you have to be in the building if your patient's under, or anything that says you have to be within a certain yard or feet?
Yes.
Yes. I was like, miles, not the right one. Certain yards or certain feet within the patient that you're being treated. I'm trying to get to the heart of this in case of a medical emergency situation and how close a surgeon would be to the patient.
Most hospitals will require you to be in the building. You can't go sign in, do your pre-op consents, et cetera, and leave and go do a clinic or see a patient in another facility or another building. They won't. That's not good care, and most of the times not allowed by hospital laws.
Okay, but that would be dependent on the hospital. There's nothing in any other...
Not that I know of.
Okay,
yeah.
Thanks.
Representative Stinnett?
To inquire.
Go ahead.
Can you tell me, in the rural communities that you were speaking of, what types of procedures you were doing there? Were they different?
The community was Rolla, Missouri, and it was kyphoplasties, lumbar discectomies, lumbar decompressions, and anterior cervical discectomies and fusions.
Okay, thanks.
Could you repeat those? No. Okay. Representative Sykes?
Yes, to inquire.
Go ahead.
Would you say that the training for CRNAs is greater in scope than what you've received, and yet you're to be placed in a supervisory position? Do you think they're more than qualified to be self-sufficient and self-supervising because of their training?
Well, as a neurosurgeon, I'm supposed to know everything.
That's what I
but-
thought.
Yeah, but on
Yeah.
these, actually, the training for us for anesthesia is it's limited. It's
Okay.
what we learn on the job.
Okay, thank you.
Representative Lewis,
Just to inquire.
go ahead.
Good evening. Thanks for being here. I just want to kind of talk about like an emergency because I think that sounds pretty scary to a lot of people, emergency. And I worked critical care, ICU, and academic facilities. And so when we think of and correct me if I'm wrong, but when we think of like an emergency or, a code blue, anesthesia or CRNAs are the first to come to the rescue to protect the airway. That is what they are trained to do. So you are in good hands with your physician, anesthesiologist, and your CRNA. They're the ones who come running and intubate the patient. So I don't know, just my thoughts. Do you have any comments on that?
Yes, I don't respond to many codes.
Right.
Okay. Unless you have a head bleed or you have a serious problem that needs some sort of craniotomy, I have very little to offer. And so I kind of make sure that there's somebody running the show and I move on to my work. If I'm the only person around, I will do the best that I can in that room. But I am so specialized that my area of expertise does not extend past neurosurgery to any significant extent, unfortunately.
Thank you so much.
Further questions? If not, thank you for your testimony. We appreciate it.
Thank you.